patient is sedated, and we are about to do our first two infiltrations. This is the adductor canal and the suprasartorial. We'll start with the suprasartorial. I am using a makeshift here block needle because we ran out of the 4-inch block needles. Oh, hold on to this. We have to sterilize the leg first. We'll have to edit that part out. All right, next you're going to feel cold, wet, and scratchy. That's the alcohol solution to minimize any chance of infection. Cold, wet, and scratchy. You can pause this part. Cold, wet, and scratchy. Alcohol solution to minimize any chance of infection. Let that dry off. Next, you're going to feel cold pressure on the inside of your thigh. Cold pressure on the inside of your thigh. That's the ultrasound probe. So we just plop the probe center of the thigh. You can increase the gain a little bit. Hopefully you'll have to dim. If you need to dim it, you can. And there you see the femoral artery right underneath the sartorius muscle. We're going to go medially, and we're going to go cephalad now. We're looking for the vastus medialis to come up. There's the vastus medialis coming up. When the vastus medialis becomes parallel to the fascia of the sartorius, right about there, we're going to stop, and that's the anatomical location of the apex of the adductor canal. So we're going to go laterally again. You can see the artery. You can increase the gain just a little bit more. You may need to tap the screen for that, okay? So we're going to do our first infiltration, which is the suprasartorial infiltration. It's that 1 centimeter layer you see above the sartorius muscle, laterally to the end of the sartorius. Pinch and a burn. This part hurts. Count of 3. 1, 2, 3, ow. A couple little pops you're going to feel next. Pop. Relax. You're doing great. And right there you can see the needle in the suprasartorial. We're going to start to inject, but unfortunately, Janine, you have to come on this side because this is a shorter, this isn't our usual tubing. We're using a makeshift tubing setup here with an epidural needle. Okay, we're going to start at 5 on the way in. We're going in 5 cc's. Keep that needle in plane, and we'll follow it along. Where did that needle go? There it is. How much is in? Okay, we're going to come back out with 5. Go ahead. 5 on the way out. And remember, it's easier to push because you have less resistance. Good. All right, now we're going to go ahead and go underneath the sartorius muscle. We're going to do the second infiltration of the adductor canal. You can see the needle coming in there underneath the sartorius muscle. There it is right there. We're at the apex by the artery. Why don't you take a picture of that if you can? Yeah, that's fine. Perfect, thank you. Go ahead and start injecting. We're going to inject here by the adductor canal, the femoral nerve. I'm sorry, you're going to help me hydrodissect over the artery. So go ahead and puff, puff. Hold on. Puff, puff. You got to pop over that artery there. We did. And go ahead and infiltrate in there a little bit. Right at the edge there. Good. Hold on, how much is left? Good. And where's that needle again? Good. We're going to go underneath the vein, and this is where you have a potential for intravascular injection. So we're going to release pressure, and then we're going to go ahead, pull back. Go ahead and give me a few cc's there. Where did that needle go? There it is. Keep going. Go to 5. Keep going. Good. And then we're going to go ahead and deposit the rest here. Perfect. Excellent. Great picture. Great infiltration. Wonderful. I'll give you the rest of it here. Give you the rest of what's in the tubing here. Hopefully you'll get 7 days out of that. Needle's out. We're going to do the next block. This is 2 infiltrations. Next one is the IPAC. That's the infiltration between the popliteal artery and the capsule of the knee. All right, we're going to do, in a moment. Cold pressure behind the knee you're going to feel, sir. Cold pressure behind the knee. Notice the patient hasn't been moved, turned, same position, frog legging. I'm going to push your knee up against my hip. You don't need to move, I'm just telling you what I'm doing. Increase the depth by 2 maybe. 1, 2. There's the femur. We're going to go to past the condyles where the femur gets flattened out, and then I adjust the angle of the probe so that the femur is parallel to the floor, Pinch and a burn. This part hurts. Nobody likes this. Count at 3. 1, 2, 3. Ow. Couple little pops you're going to feel next. There's the artery. It's very difficult to see in this picture. And let's get a picture of the needle. It's right there. Pinch and a burn. Yep. Go ahead and start infiltrating. And we're just going to go back and forth. Back and forth. Back and forth over the femur. Little sensitive there, sorry. If we go medially, pull the needle out, we're making sure to get the obturator plexus there. And keep going back and forth. Make sure you pull out the needle enough to get the obturator plexus. Keep going back and forth. We're almost done, and that's it. I'll give you this last little bit. Hopefully you'll get a good 7 days out of this. Needles out, we're all done.